Well, the month of October is Breast Cancer Awareness Month, and breast cancer patients actually may need colonoscopies earlier than the recommended age. We've got Dr. Mark Parker joining us virtually to explain why. Dr. Parker, hi.
Hello, how you doing?
Good, good. Well, we're talking about, colonoscopies and, looking at the normal age recommended by the CDC, but you guys are suggesting, we do it a little bit earlier.
Correct. Now, and that has to deal with, like you said, this is Breast Cancer Awareness Month, and we always want to make a push with our patients about the three most commonly screened for cancers in female patients, which would be breast, cervical, and colon. But once a patient is diagnosed with breast cancer, then that changes her risk for potential GI cancers, specifically colon cancer, and they're going to have an earlier recommendation than the current age of 50. So normally, if a patient is in her 40s already, as part of her workup, she will go ahead and get her colonoscopy either before she starts her breast cancer treatment, or she'll focus on her breast cancer treatment, and then once she's cleared from her surgery and or chemotherapy, then she'll come in later that year for her colonoscopy.
Well, Dr. Parker, also how important is family history? A lot of people's mothers, grandmothers may have, or fathers or grandfathers rather, may have dealt with this. How important is it for folks with the history of that kind of cancer in their family to get tested?
Absolutely, and the easiest way to remember that is if you have a first-degree relative, which would be brother, sister, mother, or father, or even a child, because sometimes our 70-year-old patients have a 50-year-old child who's been diagnosed with cancer. So any direction of a first-degree relative, you need to have your colonoscopy performed 10 years younger than when your relative was diagnosed. For example, if your father survived colon cancer at 56, then your screening age would be 46.
Wow.
Instead of waiting till 50.
That's good information, doctor. We've got three screening tests we know for cancer for women. We got the mammogram, the pap smear, and then colonoscopy. There's another test, it's a Cologuard test. It's sent from home. Is that equal to the colonoscopy?
That's a great question, and there's a lot of data and a lot of information currently that may be misconstrued. The Cologuard test is a great screening tool specifically for someone who's very hesitant to have a colonoscopy performed. However, if we compare apples to apples, the Cologuard test, if it's positive, is testing for cancer at the 90% rate. A colonoscopy can find polyps at a 94% rate before they ever turn into cancer. So they are not equal in the efficacy of finding polyps, which is actually what we want to do when we do a colon cancer screen. We're not trying to wait until we find a cancer. We want to prevent cancer by finding polyps and thereby removing them before they have a chance to turn into a cancer.
All right, Dr. Mark Parker, some very useful and informative information, necessary information for us, and we appreciate you joining us. Thank you.
Thank you.